Okay, so this is the final video here. Rubeola. What are we going to see with rubeola? Hola, in the mouth. Hola, we have these white spots. What are those called? Koplicks spots. Those spots that are white are going to spread, and you're going to have a rash on the face. It's going to be blotchy, and it'll spread to the rest of the body. When is MMR given? 12 to 15 months. When do we give the pneumonia vaccine? That's given to elderly patients, say over 65, or those people with a chronic illness, and one dose lasts a lifetime unless you're immunosuppressed. You might have to get it more than once. All right. Glucocorticoids, what's a big thing to watch for? Risk for infection. If we're taking a cephalosporin like cephedrol, cephalosporin, cephedrol, what are we watching out for the cross allergies? Penicillins. What are the signs and symptoms of diabetic ketoacidosis? Fruity breath, Kushmal's breathing, abdominal pain, thirst, and also ketones in the urine. When we're going NPH, what's the timeline on that? 8 to 12 hours. If we're giving isorbitade dinitrate, nitrate, think of angina. What do we have to watch out for when we're giving those anti-anginals? Right, orthostatic hypotension, rise slowly. Cyclobenzaprine. Cyclobenzaprine, it's a muscle relaxant. It's going to increase your range of motion. Good luck remembering that. Docusate sodium and pericolase or castor oil. Pericolase. Stool softener, when would you give it? I mean, after myocardial infarction or after some tearing during birth, so you're not straining, you're not doing the Valsalva movement, or you're not tearing your perineum apart again. Okay, we know phenobarbital, it's a drug you're good at. You give it for seizures. You also give it for an anti-anxiety. You take it the same time every day. You never discontinue it abruptly. 1 grain is 60 milligrams. Lactulose, it's your favorite. What's it for? It's for hepatic encephalopathy. It's going to make you 2 to 3 soft stools a day, and it's going to bring down your blood ammonia levels. Glipizide. It's an oral anti-diabetic. And remember, you can only use it if you have some beta functioning present. It's not an oral insulin. Okay, if you have chronic heart failure and you're on digoxin, watch for the heart rate. In a 6-month-old, what should the heart rate be? About 80 to 150. 70 when they're sleeping. Okay. Phenazopridine. You fucking love this one. It's the Dyne one. It's the UTI analgesic. Gentamicin. Do you have mice in your ears? Check for ototoxicity. Oh yeah, hard of hearing in old people. What's it called? Presbycus. Deltaparin, enoxaparin. Think low molecular weight heparin. You want to hold it if there's overt signs of bleeding, such as positive guaiac stools. Back to Phenazopridine, it's that dine, that analgesic. Dine, you take it with food. Okay, signs of hypothyroidism. Go. Okay, think of that like really cold person holding the bottle of lotion. They have dry skin and hair, a loss of body hair, constipation because nothing's moving, cold intolerance, lethargy, fatigue, their metabolism's not running very high. They might be really weak. They might have muscle aches, like stuff isn't moving. They might have edema, especially around the eyes, menstrual disturbances, maybe cardiac enlargement, and also like goiter. So they're like cold and shivering, holding their lotion. They got this big goiter. Okay, signs and symptoms of hyperthyroidism. So increased metabolism, like tremors, with hormone supplements, irritability, palpitations, and weight loss. There's something else about having like clear skin. Okay, we're on to heart sounds now. What is stridor? Woo! It's very harsh, high-pitched sound, and it means airway obstruction. Tell the RN right away, who will tell the doctor, and you're getting ready to trach that person. All right, S1 is the AV closing, the mitral and the tricuspid. It's a lub sound, and it's softer. You can confirm it by palpating the carotid artery. S2, what is it? It's the semilunar valve closing. It's S2, it's the dub. What is S3? Ventricular gallop. Kentucky, Kentucky, Kentucky. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Kentucky, Kentucky, Kentucky. That is kind of a normal heart sound if you're under 30. Don't stress it. It could be a sign and symptom of heart failure, though. It's S3 is the passive ventricular filling. S4, that's atrial gallop, and it sounds like Tennessee. Okay, what is the highest breath sound that you can hear over the manubrium? So that's going to sound like a loud, hollow pipe with a long inspiration. And there's a distinct pause between the in and the out. That's called bronchial. Down here, when we get in between the first and second intercostal space, by the sternal border, or T4 by the scapula, bronchovascular, and though inspiration and expiration will be equal. Way down here, what sound is that? Vesicular, and what does vesicular sound like? It's a long expiration. I might have fucked you up on the first one. Okay, we'll come back to that. So vesicular is okay, so back to the bronchial at the top. That should have a long expiration. So it should be okay, so from top it's that pipe sound. Bronchial, vesicular, equal, and then when we get down to vesicular, it's that side, that short expiration. Sorry if I messed you up. Okay, the rule of nines, it's pretty easy. 9, 9, 9, 36. Cubic area is 1. Each leg is 18, and that's circumference. Okay, the Somogyi effect, what is it? Basically, you just get agitated at night because you're tired. Nope, just kidding. That's sundowning. Good thing you're still with me. Somogyi effect is the blood glucose level. So when you go to bed, it's high. That's annoying. And then at 2 a.m. it dips. And then when you get up in the morning, your blood glucose is higher, which is kind of nice. Thanks. What's the most dangerous kind of enema? Yeah, tap enema, fluid volume overload. The fundus involution process. This is pretty cool. What happens right after you give birth? Uterus contracts to a grapefruit. What happens in the next 6 to 12 hours? It rises back up to just below the belly button. And then for every day, it'll go back down a finger breadth. Okay, gravidaparita. What does G and P mean? G means gravida, the number of times you've been pregnant. What does P mean? Parida, the number of births you've had that are over 20 weeks. Get pal. G means gravida. It's the same thing. How many times you've been pregnant. T, term births. P is different. Preterm births. A, abortions. L, living. So again, the difference there is the P is not parida. It's not how many births you've had over 20 weeks. The P in get pal is preterm births. Remember, term comes right before it, then preterm. This is cool. If you're wondering about fundal height, it should equal the fetal age in weeks, plus or minus 2. Okay, amniocentesis, if you get it done early, if you get it done 15 to 20 weeks, you're going to want to make sure your bladder's full so it can support the weight of the uterus. Okay, if you have a leg cramp, what do you want to tell the person to do? Dorsiflex and extend the knee. What is Leopold's maneuver? Systematic way of palpating the fetus through the abdominal wall. What should the fetal heart rate be more than? 110. Intussusception. Very interesting, right? That involution proximal to distal. What you might have in the stool is blood, and they call this a funny name. Current jelly-like stools. And the kid who has this is actually going to be painful to them. They might have the knee-to-chest reaction. Okay, so you're unfortunate enough to be in a situation where you notice VFib. AFib is pretty common, you're watching for a clot, but VFib is fucking serious. It sucks. You have to stay with the client and just start CPR. That is your priority. Okay, alcohol withdrawal, what are we expecting? Hypertension, disoriented, hallucinations, anorexia, fever, insomnia. Okay, autonomic dysreflexia. It exists. Spinal patients, watch for it. Okay, morphine overdose. Naloxone, boom, you had it. There's another one. Assholes, but it does start with NA, which is helpful. Naloxone, nalmefene. It's an older one. Okay. We're going geriatric here. After a fall, what are the early signs and symptoms that you want to report? So we're thinking fall, we're thinking possible increased ICP or just change in neurological status. Always first, level of consciousness. Then we can go to nausea, vomiting. The later signs are going to be anything to do with posture, muscle weakness, and then the eyes are later. Someone has C. diff, put them on isolation. No one wants that poopy bacteria. Okay, so you have a diabetic. They have peripheral neuropathy. They're coming in with a pressure ulcer. What changes am I reporting to the RN? If the pedal pulse is weak or if they deny pain. Basically signs of low perfusion. Okay, pneumonia in an older patient. Geriatrics are weird. What signs and symptoms will they not have? They might not have a fever and they might not have abnormal breath sounds. But they still will have the confusion, the colored sputum, and the tachycardia. Okay, if you have a UTI and that person has a fever, primary intervention is hydrate first. Then you can give the antibiotics because the hydration is going to cool them faster. The antibiotics will take longer to work. Okay, you're giving eye drops and ointment. Eye drops first, ointment second. Okay, what is sundowning? That's what we talked about before. It's you just get tired, so you get agitated. Somogy is the blood glucose levels where it drops at 2 a.m. Okay, did you fall? You just can't stop once you start. So that's the number one precaution for falls. If they've had a previous fall, then you're worried. If you don't treat BPH, what are you going to have? Urinary reflux, and it might cause hydronephrosis. Sucks. What's the number one position for CHF? Upright, feet on the floor. So legs in a dependent position. Carbidopa, levodopa. Important things to remember. Do not take high protein with it. You may sweat or your urine may be dark orange. Don't pick it if it's bright orange. Dark orange with carbidopa, levodopa. And get your liver and your kidney functions tested. Okay, we're back to geriatrics. Someone is complaining of increased frequency and urgency and nocturia. What are you thinking? That's just normal. If it was a pregnant person or an adult health, you would be thinking UTI. Okay, Lasix. You're giving somebody, what do you want to monitor for? Hypo states. Okay, what do we monitor when we're giving low molecular weight heparins for overt signs of bleeding? Okay, Lycra. Pregabalin. Lycra decreases joint pain and increases ROM. Okay, what do antacids actually do? Pew, 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 pew. Antacids neutralize stomach acid, and you'll be surprised how high it is. Over 3.5 pH. I mean, our stomach acid is capping at 4 for everything I've read when you're checking NG insertion on the litmus paper, but antacids are bringing it up to 3.5 pH. Okay, if you have something dyne, what is it? Ranitidine. Dyne are H2 receptor blockers. And I just remember that because like H is kind of like a dinner table. You can dine on it. Okay, that's all we have for final study. Good luck.